Thank you so much, Chris, for that. The story puts what we do in the context. I just want to reiterate that this system works as long as three things happen. First, people activate CANOTIFY on their phone and keep it on. The larger number of activation, the larger public health benefit. Second, once the CANOTIFY user tests positive and receive a code from us, they should use it within the first 24 hours. So that would alert other users about their exposures. After that, the code will expire. This is a key step to make system work. In the context of manual contact tracing, this step would be similar to when a COVID-19 positive case provides information about their close contacts, and then the contact tracer reach out to them about their exposure. Finally, the third one, those who receive an exposure notification should follow CDPH preventive guidance, such as testing and self-quarantine, to reduce risk of transmission to others. Next slide. Now, on the first issue, adoption. As of now, we have reached nearly 14 million Californians who activated CANOTIFY on their phone. Within the first few weeks after the state launch on December 10th, we observed a sharp increase in number of activation. You will hear from other panelists about the more detail of our metrics, but I want to highlight two issues. One, a much larger activation have occurred among Apple phone users than Android users, as you can see now. Apple made the EN available as a part of their iOS operating system. Android users, on the other hand, should download an app from the Google Play. So for example, just a couple of weeks ago, we deployed an availability notification on all Android users in California who didn't have CANOTIFY on their phones, and that increased the Android adoption by nearly 13% within a few days after that. Those are the kind of things we're trying to do within the next weeks and months coming. Second point, because of restrictions that help to preserve users' privacy in one hand, we have to use indirect methods to estimate adoptions, as well as many other metrics that we use, and you're going to hear about them throughout the day. I just want everyone to keep that in mind. Next slide. So as I mentioned, the second important key step is using code. Right now, CDPH automatically sends codes to almost all COVID-19 cases who have a record of positive test result in our central lab recording system using SMS. As you can see a picture on the right. Code automation was a key factor for the statewide launch, but those who test positive can obtain codes from other sources, you see San Diego call center or contact tracing system. Users should click on a URL link, as you can see in the picture, and follow a few steps to complete the process to trigger exposure notification. We learned that not everyone who gets the code from the system clicks actually on that link, and not everyone who actually follows the step that needed in order to complete the process and trigger the exposure notification. We have a series of enhancements in the pipeline to improve both the steps. For example, in June, we deployed SMS intercept function for iOS phones that would detect an incoming SMS that you see in the right picture and transform that into a system-generated alert and displayed based on the local language on a user's phone. This improved the code claim substantially, as you can see. We're working with Google to deploy the same technology on Android phone next week. Next. Lastly, it all comes down to what people actually do when they get exposure notification, and they go for, when they get a notification, they go to our website to learn about what they should be doing. Some studies have shown that roughly half the people who receive exposure notification take some protective actions, but there are variations, of course. Our web supports 15 languages spoken in California, where we use several human-centered design approaches to deliver an accurate, up-to-date, and user-friendly public health messaging. And we are in the process of making our websites even more impactful. Next. We have learned so much over the past year about this new technology and are about to embark on another phase of our program by conducting marketing push surveys of users that can help us better understand the program impact, more sophisticated analytical approaches, and series of system enhancement that can help improve adoption and code utilization. It's humbling and important to note that we only had about half a year actually engaged with these types of activities. CANOTIFY was launched around the time of last winter surge, when the public health system was stressed by a number of cases and also planning for vaccine distribution. We participate with UC San Diego Health and other partners to implement and evaluate this program. Given there was no precedent for this technology, it looks basically, it took us some time to learn about the system, deal with so many unknowns, understand the data system, sort through the several legal and privacy issues. Next slide. Today, we are marking 1 year of the partnership with our partner, UC San Diego, Apple, Google, and so many other local, national, and international contributors. We feel it's a perfect timing for us to gather and discuss what we have learned over the past year and discuss how we can better shape the future of the public health together. I'm very excited about the next 2 hours. So we have an amazing lineup of scientists, researchers, thinkers, implementers, and visionaries to share their thoughts about us with us, and hope this beginning to engage with some questions to help us to improve the field forward. With that, it's my great pleasure and honor to welcome Dr. Miki Tripathi, who is the National Coordinator for Health Information Technology at the US Department of Health and Human Services.